probably a role for medical and surgical weight loss depending on the patient. Some patients will respond to medical weight loss and may see adequate control of their disease, but some patients are really not going to. And unfortunately, the data doesn't pan out for medical weight loss for patients with severe obesity. In those patients, we really should be considering surgery.
I agree. I think I've gone to the analogy between other medical diseases and treatments and bariatric surgery as a treatment for the disease of obesity.
Exactly.
For example, for hypertension, there are multiple medications. Some people require multiple medications. Some people require one medication to control their hypertension. Obesity is a disease, and it's the inability of the body to regulate the body weight. Just like hypertension is the inability of the body to regulate the blood pressure. So there are treatments available. We offer treatments. Some of the treatments just happen to be surgical treatments. So yes, there are medical treatments and surgical treatments. And there's a whole spectrum of treatments which exists for most other diseases. So I think once people understand that spectrum, then they are more accepting of surgery as a treatment for their disease of obesity.
And I think we need to start pushing the understanding of this disease away from weight loss and it's toward metabolic health. What we do is metabolic surgery, and weight loss is a component and a result of metabolic improvements. And so the end goal isn't just the number on the scale. It's improvement in medical risk, longevity, quality of life, and even as much as workplace productivity and things like that, psychological health and more. So when we're treating patients for their metabolic health, surgery is a part of that spectrum of treatment, like you said. But sometimes we need to tailor that approach to a patient's specific disease presentation. Sometimes that's medical, sometimes that's surgical.
Yeah, obesity has to be looked at as a medical problem. I mean, it's a medical disease. The problem that I see that a lot of patients think that it's a personal failure.
Exactly.
And it's not a personal failure. There are so many factors that lead to why someone gains weight, whether it's genetic, environmental, or a combination of both. Again, the whole theory of the metabolic set point, the yo-yo dieting, people who've dieted more than once have gained and lost, and now whatever they're doing is not working. Now, are they really in that metabolic set point where now the body has adapted to all the different diets and is not going to respond? So many times you hear patients tell you, oh, I've lost 20, I've gained 40, I've lost 40, I've gained 20, and they keep yo-yoing for years. And the question I always tell patients is, if you've done this for a few years now and it hasn't succeeded, what's going to change? The reason why surgery works so much, in my opinion, better is that surgery changes, number one, the inside, the anatomy, hormonal regulations in the GI system. Plus, it also helps patients understand the mind-body connection and how all of a sudden they feel full, all of a sudden they're not as craving as they were or hungry as they were or things, from that nature. So I think that's why. Plus, of course, treatment of chronic medical diseases.
I think when you look at the medical versus surgical option, another important thing is to individualize each treatment. Surgery is obviously a treatment, just like the medication, as you touched on before. And I think it's really important to look at each individual patient and what their related diseases are, and decide which is the best option. And there may be patients that may benefit from medical therapy, but we often think that surgery is a better option in many patients because it's way more effective, and the long-term weight loss and the long-term improvement of the overall health of the patient is significantly better than medical therapy in many cases.
And this is a lifelong disease, so it doesn't get cured right away with changes in diet and exercise, despite those being necessary things. So you have to approach it as, how can we affect someone's lifespan? How can we increase their health span? How can we reduce their medical problems? And that means not everybody gets the same surgery. There's multiple different options that we tailor to each individual. Some people may have more, may lean you towards a gastric sleeve, some towards a gastric bypass, some towards a duodenal switch. Some may just need a little boost with some of our endoscopic options. And it gives us flexibility to tailor the weight loss to the person.
I like that idea of tailoring the approach, because viewing bariatric surgery as not a one-size-fits-all type of procedure, you could extend that to the concept of obesity. There's different stages of obesity. Some may respond to behavioral interventions, exercise or dieting. Some might be very responsive to weight loss medications. And unfortunately, pointing to the idea of the metabolic set point theory, a lot of times people do yo-yo with those interventions. In those situations, particularly severe obesity, you have the option of a bariatric procedure.